Good morning, guys. Welcome back to the vlog. My mum's on her way around here, so we're gonna have some chats with her today, which I'm very excited about. Woo! Hence the bananas are out. My mum's just as big a fan as I am. I'm going on a little excursion, which I'll tell you a little bit more about in a bit. But yeah, my mum is on her way around here because we're gonna delve into some topics that I really have wanted to discuss for a long time, kind of as just like part of my 30 for 30 list. So I've got the list of 30 things that I want to do to celebrate the fact that I've turned 30. And one of those things was kind of just raise awareness around women's health, around sexual health. And listen, okay, so the theme of today is breast cancer and breast health. And I realised that that doesn't at all really come under sexual health, but my mum's attitude towards sex really impacted the way that she taught me about my own body, because ultimately she just thought that talking about our bodies was a really dirty thing. My mum's also just like really cool, so getting to see what she's wearing is going to be a big highlight of today.
I just jumped back into bed to get a little bit of admin done because I'm choosing to take today as a filming day with mum, which means I still need to get my work done beforehand, obviously. But it's 7:30 now. Mum will be here about 8:15. I think we both do feel a little bit nervous because we have only just started to have these discussions ourselves. So yeah, I think you're going to hear a lot of things that maybe we haven't actually necessarily discussed, but it do be like that. I feel like a lot of families just don't really talk about these topics, and hopefully this will be helpful for someone. I just realised I didn't actually introduce this video. Guys, I'm not getting better at this. Hi. I'm Sav. Thank you so much for being here. If you're a repeat offender, sis, thank you. You'll be so proud to see that I'm wearing jeans. You see them? And if you're a newbie, hi. I don't really know what my niche is, but I appreciate your presence.
You never guess what
Just your
happened.
question. Hi, what?
Oh my god, such lovely people. So, because I was running late, I took a taxi.
Okay.
And the guy said to me, "What are you doing?" So I told him it was for breast cancer and Dr. Nia. And he's absolutely like burst out in tears. Didn't take any money from me.
This is for the YouTubes. And I was just explaining to them this morning that actually breast health isn't something that like you and I ever discussed until I had my breast reduction. I actually don't think I spoke about my breast reduction, but it's just not something that me and you ever had a relationship around. Like, we just never spoke about it, right? And I actually think probably until I was like 26, 27, a lot of like the strain between us was probably because I felt quite judged by you and quite scared to like speak to you about anything to do with my body. But now I'm realising that you have a lot of fear and a lot of like trauma around the way you were brought up. And you wouldn't have known to teach me about breast health. Like, I keep seeing this meme at the moment, I think it's kind of going viral, and it's like, it's your parents' first time at life too. Every time I think about your relationship with sex and our bodies, and like, I have been annoyed, but I'm trying to be like, no, she actually didn't know. Like, you, in some of those instances, you are actually still a child, and like, you're learning about all this with me as well. So I thought what we could do is we could go and speak to Dr. Nigap today, which obviously I've given you the heads up on, but maybe she could teach us some of the phrasing around our bodies, around breast health, some things that we didn't know, some taboos, and hopefully just teach other people how to speak to their loved ones about it. Because what I'm hoping is that if people have the correct language and the correct information, then it will feel less nerve-wracking and less scary to talk about it within their own families. Because you literally just didn't have the tools.
Yay! Hi! If you're wondering what Breast Cancer Now's offices look like, it's very colourful. So, me and Mum have actually just been having a little bit of a discussion at home.
Yeah.
About my promiscuity. No, I'm kidding.
Talk about that.
Yeah, I know, I need therapy.
How many have there been? No, joking.
Another day. We'll talk about this later. I'm kidding. And actually, just the fact. Oh, actually, we were talking about this story whereby when I was younger, there was a young man in my bedroom, and we had the discussion. The boy jumped out the window to avoid having to address my mum, and it was a whole thing. And basically, the long and short of it is that me and my mum didn't have the best relationship around like sexual health and our bodies growing up. We just didn't really know how to communicate those topics. And now that we're having these conversations, we're starting to realise that like we also didn't talk about our bodies and our health and our breast health, and neither of us even realised checking our breasts would be relevant to us as South Asians, so we just never learnt to do it. And yeah.
when did that conversation sort of come around and you thought, now?
Really recently.
2024?
2023?
No.
Quite recently.
No.
What about breast health? And so, yeah, for sure. We've never had this conversation.
breast
What
health.
drove
Yeah.
that conversation?
Kind of like a tension between us. And we just we wanted to break that down because we didn't realise how much speaking about your bodies, how much of an impact that had on our relationship. And yeah, we just didn't speak about so much that was so important to us.
So the first thing is, actually, what you're saying is really normal. So in my clinics, I often find that I rarely see teenagers or younger women unless there's a problem that they come in about their breast health. But actually, as soon as we develop our boobs and breasts, we should be checking them and making sure that we know what our normal is. But you sort of started off in a really poignant point, because you said that we just don't talk about our bodies. And being South Asian, so I speak Punjabi, we don't have a word for it in our language.
Absolutely.
It's chati, which is like, doesn't even translate
Chest.
to breast or chest. Exactly, Shai. So if you don't have a word, how do you even have the lexicon to be able to communicate that with your mum?
Yeah.
Especially when something is so hidden.
Exactly.
Did you ever find that that was the difficulty?
It wasn't a subject that I was brought up talking about. It was, as we were saying earlier, it's linked to being promiscuous, so you just don't talk about it.
We were
Breasts
actually...
are so hypersexualized.
Exactly.
I just find that they are. I feel that. I mean, they're not mine. Before they were sort of mine, but they just got sore whenever I had periods.
They just existed on
They
you.
just existed on you,
Yeah.
and then you have babies, but they're not for you because they're to feed your baby.
Yeah.
Maybe for your husband sometimes.
Oh, we don't talk about that.
No, we don't talk about that.
No.
And then now that I'm older, so I'm approaching 40s, and still I feel that they're not mine. I'm also just waiting for the screening process. And you'll be shocked, actually. The statistics show even doctors don't check themselves,
Really?
even though we know that we should be checking.
I just didn't know. I know this is insane, but I just didn't think it was relevant within our culture. I just didn't think it happened to us. And then recently, family members are going through breast cancer scares and friends and stuff, and it's the first time that I've been like, oh crap, it's something that we need to pay attention to. Like, I actually need to go check, and I didn't know where to start. I didn't know that you checked up here. Like, I didn't know any of these things, and realised that we had just never had any of those discussions.
Or check nipples. Or...
Literally. In fact, like, Mum only saw my boobs, or we spoke about boobs for the first time just generally when I was 20, because I had a breast reduction, and it was like the first conversation we'd ever had. So got past the teenage years before we even discussed.
So is that when you first examined her, looked at her breasts?
No,
First time you saw them, really.
the first time I saw them, because we spoke about a breast reduction, and I just said, can I have a look how big they are? And they were G, 32 G or something. I just broke down in tears because it was unbearable to watch. But I never spoke about breast health. Didn't even enter my mind that that was something I needed to address. It was just the breast reduction, and after that we didn't speak for until recently.
Which is so funny, because actually getting a breast reduction was probably the first time I'd have been checked, or actually anyone had examined my breasts for anything like that.
Culturally, you hit a sort of a really sensitive point for me, because when were you ever talking about it with your mum and dad?
Never.
I mean, probably not your dad.
Never. It wasn't a subject that was ever discussed. Hence, I did what I knew, which I thought was the right way.
And it relayed as just you being furious.
It kind of translated in me being angry, constantly. And with your daughter, this is your precious child you want to protect. And because you can't vocalise it, you don't have the vocabulary.
Yeah.
And you then follow the footsteps that you know, which is familiar, without realising that's not right.
We had a conversation this morning where, it's like kind of the first time that I've realised that Mum was like scared. Like, we were talking about how, I actually think it's the first time I told her, when I was 14, how sometimes your parent will say something and it will just like resonate with you for years and then you never have the discussion. When I was like 14, I had these massive boobs, and we were going to, it was summer and it was like 30 degrees or something, and I was wearing a little black vest, and Mum was like, don't wear that, it's kind of slutty, don't wear that. And I was like, Mum, that rung in my head resoundingly for years. And she was like, no, I was just so worried about the way other people would perceive you. I was worried about like our family image. I was worried about the way men would look at you. I was worried about your safety. And she was like, I didn't mean to do that. She was like...
It was not knowing how you have the right vocabulary to be eloquent enough to say, look, it's not you that I'm worried about, it's...
What about going for like bra fittings and things like that?
Oh my God, horrendous. I would never go. I was so scared.
Why?
Because I thought, underwires cause problems.
It's sexy. We just didn't...
It's sexy. Why do you need sexy lingerie? It wasn't something that ever occurred to me. I just take her to Marks and Spencer's, and I used to get told off by my husband did you let her go in on her own with a lady that, well, it's a woman checking? No, I don't want to. So it was just, we were both so naive to these things.
It's so common that I hear this, and I'm just reflecting back as my experience as well. And I just remember I was about 18, and I was at medical school at that time when I first went to Marks and Spencer's and had a woman measure up me for a bra, because my mother, just the thought of asking my mum for money to get a bra. I mean, I wasn't big in any way when it came to the size of my breast, so it was easily hidden with a vest. But I think I was wearing vests right up until I was 16, 17. And then changing at school in the changing rooms. Do you remember? Like, that was horrific. That was a horrible experience. And then all the girls, or the white girls, unfortunately, I don't mean that in a racist way, but the Caucasian girls would always have like bras from the age of 11.
Cute little lacy ones.
Lacy ones from 11 and 12, 13 onwards, whereas I just hadn't had that conversation with my mother. Yeah. And you're absolutely right, it's that hypersexualization.
I just couldn't understand how, if Savannah was invited for a sleepover, because of her breasts and me being so protective, she'd have to have matching different bras for an overnight sleep, one for the t-shirt, one for the pool, one for this, and
that's a bikini, Mum.
do you know what I mean?
No, I know what you mean. Like, everyone else had like cute little matching sets, or like all my Caucasian friends, their parents just seemed to buy them little cute Marks and Spencer's crop tops and things, but it wasn't something like I remember having to save up my weekly pocket money to go get a bra, and so I wouldn't really be able to go do it much else with my friends, but like I should have been able to talk about that at home.
Yeah.
But you didn't. You were so scared about our bodies.
Yes. And it was an inbuilt fear. I just didn't know any better.
I find that the biggest pickup of, say, breast changes or breast health are actually by the partner. So I wanted to ask you, Shai, with your other half, what is it like discussing breast health or examining? Because I'm just thinking so many women come in and go, my husband actually noticed a lot.
It never happened. You bringing that up makes me cry. Because sex was for him. Not for me. It was my ex-husband.
That's so sad.
I told Savannah this morning that I shared something that I enjoyed doing, and I was traumatized for years. You're a slag. You this, you that. So sex wasn't. It was for his pleasure. It was as and when he wanted, how he wanted, whichever way. I had no autonomy over my body.
I didn't know this. I just thought my mum hated me. I didn't know.
I know, and it's so important for parents to be transparent, but it takes courage to do that, because you don't want your child to see you like this.
Yeah, of course. But that vulnerability
brought us closer.
Yeah.
So no, I had no autonomy over my body, and sex was something I didn't enjoy. And then when I spoke to my friends, they would be buying lovely stuff, and they would ask me, and I ended up creating this personality that was different for friends and family and one at home, because I wanted everybody to think I had a lovely marriage.
So I think that firstly I'm so humbled that you shared that with me, because I know how difficult it is, just from a South Asian to a South Asian woman, understanding the cultural nuances. And when your body's not your own, you don't feel that you need to take care of it or look after it, or that your breasts, examining them is not yours. So when I get a lot of women who go in, but my partner, and actually I'm just thinking back, have I ever had a black woman or a South Asian woman come and say to me, no, it's actually mostly been my Caucasian patients that will come in and say my partner picked up a lump, because I suspect that's because men don't know what they're looking for in our community. No. It just occurred to me, I don't think that men realise that a lump on the breast or a skin rash on the breast or something they might notice on their partner is worth telling her about and saying to her, go and make the appointment.
I feel like it would almost be shameful within our culture.
Exactly, that's what I'm thinking. I just wonder whether that's the disconnect, that I don't want anyone to think that there's an issue with my partner because of promiscuity, that she's a sexual being.
Yeah.
That her pleasure is really important.
I wonder if your dad even, like I'm saying I didn't know any better, maybe he didn't know any better either.
You say that, but like growing up, like I think back to every illness, and it would somehow be our fault. So he would,
even if you got a cold,
he did check, even if he did see anything, I assume he'd think it was your fault, and he would bring shame.
Is that the karma?
Yes, it's again your karma. You deserve that because you didn't do this, or you must have done something bad in your previous life, or
It's crazy to hear out loud, isn't it?
I know.
It is so crazy, but actually, do you know what's so common? Because especially, so as a Muslim woman, your faith is paramount. And so when you're talking about your faith, it's almost like if you become sick, it's because you must have done something to frustrate or anger God or Allah. And so your piousness is questioned.
Yes.
Yes, very much seen that replicated in our family, haven't we?
We couldn't.
But we don't have these conversations, and it's crazy when you say them out loud. Because why would God give you something and
Isn't it
question
because
your
our
faith?
parents did that? It has never been spoken about. You kind of put up with your lot, even down to violence. I remember, a woman has to accept it. A slap is, it's normal. So why would they talk about sex and breast health, and it's just not important? It's almost like you don't matter.
But the statistics show that although Black and Asian women are the group that don't go for screening, but early diagnosis, if you pick up stuff early, we're actually saving lives.
Yes.
The prognosis is better. So you being aware, Savannah, now about your breast health means that if you do pick up something early and get it checked, you will outlive your diagnosis. Isn't that the crazy
incredible.
thing?
Yeah.
That's
Actually, your parents
incredible.
pushing you to check and you being on top of it.
Yeah.
Make a world of difference.
It makes a world of difference, and having these open conversations, it's so lovely to see you holding hands. Because I think that actually, I just think about all the other mothers and daughters who probably should watch this.
Do you ever think that, because it's taken me 30 years to kind of get past the irritation of speaking about my body and sex with my mum, because I didn't know a lot of this until recently, and also for parents, like how do younger girls bring this up at home, and how do parents address
it would be
this
so lovely
as well?
if parents can be vulnerable and
How do
talk
you change
to
that? Because
it's a journey. It's certainly been a journey for me. It didn't come easily, and it's with your support.
what changed to make you more comfortable to be vulnerable with us?
I think it's literally just waking up one day and thinking, I don't know better. I didn't have a manual, and I have to be the pupil instead of the parent. I have to listen. And being, you bringing in subjects that I didn't want to address, like sex, like breast cancer, like stuff like. I remember you told me off for not going for my smear test, which I didn't want to do.
I think I've been quite bulgy at home about talking about these topics.
Yeah,
and I
my
imagine
vibrator was bulgy.
I'm so glad I did that though. But I imagine so many kids would actually be really nervous because of the fallback at home if they were to be like, Mum, I don't know how to look after my body, or like, why have you been so aggressive about this growing up? I think I actually just think we were saying to this morning that sex and your body is a weird thing to say, but it isn't a sexy discussion, and you shouldn't feel dirty to bring it up at home. Like it's such a can't speak. It's such a necessary thing to discuss.
Because as a doctor on the other side, when I see it, is that if things are picked up early, so cervical screening, breast stuff is picked up early, conversations about sexual difficulties, even sort of pain or issues around sort of your vulva or your vagina, because we know that there are about 30% of women out there who actually find painful sex, find it difficult to have sex because it's painful. And so statistics like that, and you think, God, that's crazy. That means nearly 1 in 4 women walk around. Or there's probably more than that we just don't know because we're not picking up the statistics.
We're not speaking about it as well.
We're not speaking about it and sort of putting up. So we're sort of, no wonder we think our bodies aren't our own, and the fact that they're so hypersexualized. So you almost remove yourself. But it means that there is so much dissatisfaction, and the stuff that we put up with our heavy periods, we put up with, pain and pregnancy, and it's almost sort of like, as you were saying earlier, that's your lot. Expect that. But we know medically that there is so much stuff that we could do, and on the end of it, if it's cervical screening, if it's breast cancer checks, literally it's life-saving.
If you just catch it earlier, if you just have those discussions.
It earlier, and you go for screening, And I think that the whole idea of being that this isn't a woman's lot is so important. So we've got to get the men involved, so the boys as well, so they've got to understand. And I think sometimes I often say to my husband, he goes, I feel left out of your conversations because it's a woman's issue. And I think that the only way to sort of break that is to let partners and men and sons and you know, all of them in, because if they understood
Absolutely.
your body and understood the cyclical transformational being that you are, that they'll encourage you to go for screening and things like that.
Of course, yeah. This is actually a really unrelated but funny story. My brother's just starting his own business, and this girl that he hopes to work with, she posted on her Instagram story about how she was having a really shitty period and she was just in a bad mood, and he messaged me and he was like, how do I discuss time of the month things? And he was like, I don't know whether to address or not. And I was like, honestly, if she's posted it on her Instagram story and she's open, like, I was like, I think you could address it in a really lovely, calm way, and like it's not just something for women to deal with by themselves.
And it's really refreshing. So I find that I do a lot of work out in the community, and one of the things that we worked with was Somalian women in Attar hamlets, because we know that the uptake of breast cancer screening, so going for your mammograms, is really low uptake in Black and Asian women. Firstly, just self-checking, just the importance of self-checking. And we can go through exactly how we do self-checking later.
Please.
But it was really important because we ran a workshop and the women came engaged and they sort of knew, but they said, but I need to then ask my husband to go for my screening appointment because the household chores, the kids, everything else needs to be looked after. And that's when it occurred to me that it doesn't work if you don't ask the men to attend, but how do you talk about breasts in such a conservative, reserved community? And it was actually one of the grassroots organisers at the time, and she said to me, but they won't look at breasts, they won't even look at a picture of breasts, but we know and understand bread dough balls, and as women we'd learn about breasts through bread, and that was such a light bulb moment for me. It's such a nuanced way that this community actually talks to each other. So we did another workshop. This time the men came because the women brought them, but instead of showing them sort of graphic pictures of breasts, we made bread dough balls with the men, because that's something that they do at home, and put frozen peas in there and got them to understand that these are the 4 quarters of the breast, this is what a nipple would be like, and this is what you're looking for. And it was like a light bulb went off in the men, and they just said, I completely understand why my woman or my other half needs to go for a mammogram screening. And I just thought, do you know what, that's equity. That means that we're listening to the community and sharing them an educational tool to do it in the way that they want to do it, rather than us going in and going, this is how it should be done.
That needs to happen in schools. That's a really useful exercise.
That's such a useful exercise. I know. Do you know, I often think that we need to, and it's not that hard. It's actually so cheap to do that a way, and it's so simple. And when it's nuanced in that way, actually, it doesn't cost a lot of money, because the community do this anyway. They were going to use this bread to make bread that day, that that flour or the dough balls.
I like that a lot. I think,
Such a good idea.
I'm going to write that down if I ever have a child, if I ever have a son.
Do that at home. And I think that there are so many ways that we could talk about breast health in that way, and just be able to show, everybody that if a woman is well and her health is looked after, then actually, as your brother has just realised, that if he talks about periods with his employee, if she's happy and healthier, actually his business will thrive, because she'll feel valued.
Exactly.
I think he also changed his attitude when I decided that I'll talk about menopause with him.
It was mind-blowing, completely different boy.
He changed completely, whereas he would get irritated with me when I was going through that change, and I just sat him down and I said, look, this affects you, it affects your sister, it affects our bank balance, because I can't work.
Well, menopause is another word that we don't have, right?
We don't have a word for menopause.
No, we don't.
No.
Well, sort of in Punjabi, it's kapde khatam ho gaye, which is translated as you're off the rag, but you don't have one in Gujarati.
We don't. Because I was asking my sister, and she said no, and immediately she went, shh, why do you even have to talk about it?
Do you know what? I had a chat at the mosque about this, and I was talking about sort of breast health, and because it's more important to do it as you're going towards the menopause as well. Because we know that as we get older, exactly, because the statistics show that as you get older, your risk of breast cancer, unfortunately, increases. So all the women said to me, no, we don't get menopause. White women get menopause.
Yes.
No way.
I was like,
no.
what?
About menopause?
Like, how crazy is this?
Like, read the science. It's science. You're not being punished. You've done nothing wrong. It's
But
science.
I think that actually, you know, I'm having a giggle, but if I sit back and think about it, I'm just thinking that statistically it does make sense, because the research that's done on, say, Black and Asian women when it comes to menopause is so dire, it's so limited. And then again, the way that the symptoms present, because the way they present is hot flushes. If you look at the NHS website, the first symptom is hot flushes and night sweats. And I said that to my mum, who was having a florid hot flush in front of me. And she went, darling, stand in the heat in Pakistan. You'll know what a hot flush is. And that's when I realised, oh, so the context of the symptoms, what I'm going to bother the doctor with, isn't important enough. Can't be communicated because
I've never heard mum say the words hot flush ever. I've heard you say I'm having palpitations, but I've never heard you say
it's
I've
embarrassing.
Had hot flushes.
You don't talk about it.
Yeah, because the comparison is that these aren't significant enough.
Yeah.
Because as doctors, we only learn and research if someone comes in with saying these are my symptoms. So your lived-in experiences actually drive research.
Well, the peers in my family, my sisters, just take a couple of Panadols and go to bed.
But also, you know, like, I hear the shame that you feel, but do you want your daughter to live through that shame?
Clearly
Because
not.
you saying, because I associate I'm having palpitations with I'm angry as fuck. Like, I don't associate it with menopause. So you saying I'm having palpitations right now not only scares me for what's yet to come to me, do you, like, so you're effectively giving me that lifestyle
The
in
wrong
the future.
information.
You've got to be selfish so I can learn to be.
Yeah.
Do you know what I mean? You have to look after yourself, and if you don't use the right language,
That's
how
what
am
you
I
meant
going
last
to?
night.
Yeah, like if you don't learn to look after your bodies, how am I supposed to? You know?
True, yeah.
And that's why we get perpetuation of myths constantly. You know, so we talked about the sort of the cultural barriers around checking yourself, the breast myths. Your mother never sort of said that you need to examine yourself.
Yeah.
So then you pass that on to your daughter, going, you don't need to examine yourself. The first time you looked at Savannah's breast was after breast surgery. That's only because there was a surgery, but never. We also sort of have this other myth that it's only older women that get breast cancer. It's not younger women.
We don't get them. Only white people get them.
Yeah.
See?
Well, even like we I think for the first time last week we spoke about mammograms making your boobs saggy and smear tests making you loose.
Yes.
And like that language was actually dropped into my childhood and teenage years. So like I hate to know what your parents taught you.
Oh my God.
Or your siblings taught you, or the shame that you must have felt around it growing
the
up.
other one that was, and it was a painful experience, was STIs.
Oh yeah.
Oh my god! And some of the things you went through, Mum. Oh my god.
And I never had thrush, didn't even know what it was, and then I got married, and when I got pregnant, baby before my boy, I carried pregnancy up until 26 weeks, and I was getting consistent thrush. Didn't know what it was, and asked my mum, and she, I'll just put some yogurt, it'll be fine.
Some yogurt.
Yeah. So I used to go to bed, put yogurt, and you know when you itch so much, it bleeds, and then you're pregnant and you panic. Anyway, I had a bit of a bleed, so I got rushed into the hospital, and the gynecologist said, "You've got thrush." My ex-husband accused me of sleeping around and thought that I'd contract.
Thrush is normal. It's like.
But it wasn't even it was because he was sleeping around, and I lost the baby.
I'm so sorry.
And the shame.
And the shame of it. And now it was my fault. I lost the baby at 6 months. And it was a boy, so it was like, oh my God, you never even gave me a boy. You gave me and all that that happens in our culture. And then I gave him a boy. Nothing changed.
Still fucked off, didn't he? Sorry.
Still fucked off, yes.
Don't know where he is. Why did you react to Mum saying she used yogurt?
Because I've heard that myth before, and
Mum tells me to use yogurt. Is that
and actually, there's no evidence data.
Really?
To show, no. So,
oh my God.
let me
In
just
all
break
these
that
years
news
I've been
to you
thinking
right
yogurt.
now. There is very little
There I
evidence.
was with my natural-
So, let me talk about thrush very, very quickly with you.
Just pouring gin.
By the way, this is actually a really good conversation about thrush, because people only think about thrush being... We get thrush under our boobs, by the way.
Okay.
So any skin
No
folds.
way.
So thrush is a
We
candida.
thought because we had big boobs.
Wait, no, I had like a yeasty thing. When I had bigger boobs,
Yeah,
I had
yeah.
like a. We spoke to no one. I was so embarrassed. I thought it was like.
Okay,
fungal.
let's talk about that really quickly. So we, in very lay terms, we are covered in candida or yeast, and in our vaginas, candida albicans. we have yeast everywhere on our body, under our armpits, skin folds are under our breasts as well. That's why it's really sort of, some women get an itchy sort of thrush infections just underneath their breasts, especially if you've got bigger breasts. You can be, but that's not to say that everybody with bigger breasts will get it.
Okay.
With smaller breasts you can get it. You can get it mostly when you're pregnancy, if you're run down, because your immune system's trying to fight something else, and so the yeast on your skin will flourish as well. You are born with thrush and you will die with thrush.
Really?
So just so you know, that should be actually on a t-shirt somewhere.
Yes. Oh, love that. I would wear that everywhere. I'd wear that to the gym.
Sorry. Anyway, that's a side point.
Collaboration. Like, I would love that.
You are born with thrush,
Yeah.
you will die.
I would love to run a marathon wearing that t-shirt.
That is
So
amazing,
good.
It's
isn't it?
nothing to do with sexual activity. It's nothing to do with promiscuity.
Sorry, I'm
It's
overstimulated.
because your
Sorry.
own immune system tries to hamper down the bug, your natural coliforms that are formed. In pregnancy, because your body is doing so much, your immune system just cannot hamper it down. Just to make you feel better, I had thrush throughout all of my 3 pregnancies, and it is horrid. It's so
horrible.
horrid. It's itchy, it's sore. The other time that thrush then flourishes again is when you lose estrogen, because estrogen is like this lovely lubricating hormone. It looks after the lactobacilli in your vulva and your vagina. It decreases the pH. It's a barrier between your back passage and also your vulva and your vagina. So that's why women end up getting a recurrent itch that doesn't go away. So we should be giving them back their vaginal estrogen at perimenopause or menopausal time, and also trying to treat the thrush. Now, coming back to the yogurt, it is a really common myth. No, it is such a common myth, and in fact, I've seen social media content about how you treat thrush organically or in the natural way. And the natural way is because yogurt is a fermentation bacteria, and there is good bacteria and bad bacteria. So it is something that I hear a lot in South Asian communities, that you put yogurt in there. So I'm not laughing.
No,
at
I'm
the fact that you
just
did
thinking
that.
of times when I wouldn't let you have the yogurt because I wanted it for bed.
Pour some phage in your vagina.
However, it does nothing.
No, really.
It doesn't do a huge amount. There is no evidence-based data that things like that work, and I still know that people use that. So I'll tell you some of the stuff that I've heard people try and treat thrush with. So jet washing with water. You do not need a water jet wash up your vagina, just so you know, it's a self-cleaning organ. Dettol, I've heard women using Dettol.
No, I wouldn't use that.
Vaginal pessaries as well, which some women use to treat themselves. Again, they're like meant to be a herb. Please, if you take anything away from this, please never put anything up your vagina unless you've spoken to a healthcare professional. So the thing that works really well is Canesten. You can buy it over the counter. It's really simple, and Canesten is a medical-based treatment in order to reduce the thrush, the Candida albicans in your vulva and your vagina, and then your immune system actually does the rest. So the only thing that works is your immune system.
It wasn't my karma then.
No, it's nothing to do with your karma. Your karma's beautiful. Like, let's just leave it at that.
Also, you can put some things in your vagina, just fun things,
Savannah.
not like medication.
Yeah,
Just a
within
fun thing,
reason. Yeah, actually you can. In fact, and the data does show that the biggest age group that are buying vaginal vibrators are women over the age of 40. Wow. So I love that. I love the fact that women are reclaiming their sexual sort of pleasure and realising that their body isn't just for men, and they as they approach their 40s and their midlife and into sort of perimenopause, that they're discovering the joy and the pleasure of sex, because it should be. Women should totally understand their own pleasure.
Okay, so should we jump into some myth busting? Is there anything to teach us here?
Ask me anything. Nothing's off limits. Nothing's taboo. There's no shame.
So like a big thing that I was taught is that getting a mammogram would just make your boobs really saggy.
Absolute rubbish. That's very quick.
Does it
doesn't
hurt?
make it doesn't hurt. Okay, little caveat to that. So when you have a mammogram, there are 2 plates that basically squish your boobs, and that's the reason, because we need to spread out the tissue to be able to look at it really, really carefully. And so that can be slightly tender, but actually the majority of women, and the statistics like 80-90% of women say they don't feel any pain whatsoever. Really? There's somebody in the room with you who will ask you, is this okay? And you need to tell them if you are uncomfortable at any point.
You can say stop.
And you can say stop, exactly. You can say stop. You can talk to the radiographer that's in the room who's doing the mammogram with you. You can speak to the nurse specialist as well if you do tend to have slightly tender boobs. Now, we do know that women who end up going into perimenopause, so that's when you're having periods and menstrual health, women who go into perimenopause, that's when you're having menopausal symptoms and periods. Your breasts will be slightly tender because your hormones are going to be fluctuating at various times. And that's a really other good point as well. Even if you're on your period, please still go for your mammogram.
I didn't know that. Okay. Fine.
Yeah,
There's no shut-in.
There's no shut-in. There's no. You're not be shut-in because of your going. Yeah, you're not be shut-in. And a lot of women find that because I'm on my period, I shouldn't go because it will mix up whatever's looking in my breast. Yeah. No.
How about smear tests and periods?
That even with that, right? So the official line is that if you are bleeding, then don't go for your smear test if you know that you're going to bleed. Because it can mix up the cells that we're taking off the cervix, because we're looking for HPV.
Okay.
However, I work with, in real life, our periods aren't going to be bang on like clockwork.
Just gushing like a tap.
Some women are going to be irregular. Some women will have PCOS and might not even have regular periods or have a period for up to 3 months at a time. Some women are going to go through perimenopause. Some women might have just had a baby and now they're bleeding for a month and their due date for their smear has come up. So for me as a doctor, even if you're on your period, because you're erratic, I'd rather that you made the effort to book the appointment, come and see me, and let me make the decision with you on that consultation. But don't ever be put off for booking a screening test for your breast, so your mammogram, or your cervical screening because you are bleeding.
Okay, that's really, really important to know. Another one. Do bras or promiscuity impact your likelihood to get cancer?
Absolutely not. Let's just put that out there. The number of partners that you've had, and sexual partners, whether you're in a monogamous relationship or polyamorous relationship, whether you're in a same-sex relationship, whether you're in no relationship whatsoever and using vibrators. Just because we like.
She's a fan.
Yeah, she's a fan.
You told me it was good for my health.
It is good for your health. It's really great for your pelvic health.
Literally.
Honestly, like your sexual.
I only do it for the pelvic health.
Of course, medicinal reasons.
Yeah, your sexual activity has no bearing on your risk of getting breast cancer, and that is something that we have to completely throw away. Absolutely, and also your risk of breast cancer doesn't increase if you're in a same-sex couple or literally sexual activity has no bearing on your risk of getting anything wrong with your breasts.
Period. Sexual activity has nothing to do with your breast health.
Absolutely.
Such an important
Can we get that printed on a t-shirt?
Yeah, literally.
Please?
Along with
it was the thrush one.
Yeah, that and
and this one as well.
Yeah.
The number of your body count does not equate to breast cancer. Let's put it that way.
Period. Love that. Oh, okay. 2 other myths. Does underwire cause, or bras cause breast cancer, and also does wearing deodorant cause breast cancer?
So the first one, does underwires cause breast cancer? Or actually the other one I often get is, do sports bras cause breast cancer?
I think I've heard that, yeah.
There is no evidence-based data to suggest that saying you're absolutely safe to wear underwear wire bras. In fact, I'm wearing one today. And you're wearing a sports bra.
Oh, I'm wearing a sports bra, I lied.
Yeah, so there is no link with breast cancer with that one. And then the link between deodorants and breast cancer. Now, there is no evidence-based data to suggest that wearing deodorants will give you or cause breast cancer. The little caveat that we've got to be aware of is wearing aerosol deodorants before going for a mammogram, because some of them have aluminium particles in them. So when you go for a mammogram, if you've used an aerosol deodorant, then it can show up on a mammogram as being microcalcifications. My rule of thumb actually is, it's a quick procedure. If you can not wear deodorant, perfect, don't wear it. And then after the procedure, wear a roll-on or whatever deodorant that you like. Day to day, no, there's no link between deodorants and breast cancer.
What? Do you know what? I can't. My mind's blown. The amount of time my mum has literally been like, Savannah, you need to stop wearing so much deodorant. You need to stop coming
Honestly,
out of the shower.
I believe that all my life, that you should not wear deodorant.
You're not alone. You're alone. My mother used to be like, don't spray deodorant on your boobs because it will cause breast cancer. I had that as well. Or perfume on your breasts. There is no link with that at all.
Mind blown. Oh my goodness. I don't need to smell
a lot
anymore.
of people.
Nice.
You don't need to smell anymore. Yeah, we can smell you from
I'm a
here.
smelly girl, yeah.
And underwires for the bras, that was another one. Don't wear underwires.
But I'm fine. Yeah, you're fine to... Okay, fine.
So let me talk about breast cancer and menopause. One of the
Okay.
biggest myths I get is women feel that they cannot have vaginal estrogen because it's linked to breast cancer. So topical vaginal estrogen is something that's so important because there are 2 times in our life when actually we reduce estrogen around our vulva and vagina, and it leads to a condition called genitourinary syndrome of the menopause. Now, the bit about the word menopause is slightly misleading because you can get GSM, or the lay term for that is vaginal atrophy, anytime when your estrogen drops. So we see that either just before your period, sometimes that can happen and you can get an itch. And the other time that we see it that can be prolonged for quite a while is after you've had a baby. And if you're breastfeeding, because your prolactin level increases so that you breastfeed, your estrogen level decreases. So women end up getting a recurrent itch, or they might be prone to getting urinary tract infections. Sex might be painful. In fact, if you've had an episiotomy straight after birth, you might find that the stitches come apart as well. And it might be sore in and around the vulva and the vagina. So those are all symptoms of vaginal atrophy. And for that, we have to replace estrogen back into that area. So topical localized estrogen actually doesn't get taken up systemically, so in your bloodstream. So it does not increase your risk of breast cancer.
Okay.
And in fact, what we now have known from really brilliant data is women who've gone through oncological treatment for their breast cancer, it's very safe for them to have DHEA or topical vaginal estrogen even when they're going through the treatment of breast cancer. So we are trying to get this message out there because we forget that when women are going through treatment for their breast cancer, as horrific as that disease is, actually we shouldn't forget that the woman comes as a whole. She's not just breasts, if that makes sense. You know, she will need to look after her other skin, her hair, will need to look after her vulval vaginal tissues. So actually giving topical vaginal estrogen is safe, but so many women are denied that. And I just think that's so cruel because we link estrogen to breast cancer so much. So with all of that information now that we have, and the evidence data being as good as it is, it's really important still to have a discussion with your oncological team when thinking and considering topical vaginal estrogen and a menopause specialist. But a lot of now conversations are happening that topical vaginal estrogen is deemed to be safe.
And then another huge topic, which I've heard you mention in passing but would love to know more about, is how breast cancer can present in different ethnicities, because I didn't know that it would be different.
Do you know what? It's the skin changes. So we'll go through a breast cancer examination.
Okay.
And one of the things that we look out for always is reddening to the skin, or a nipple discharge, or something that represents like the skin of an orange, you know, that sort of dimpling on the skin. And the pictures on, if you look at a lot of the NHS websites, are on Caucasian white skin. So I find that Asian and brown and black skin, it looks really different. If you say to a black person, look for reddening of your skin, they're going to go, actually, I don't see this. We need to get more pictures of what skin changes look like on breasts for black and brown skin.
Okay.
Because then we know what we're looking for. Because at the moment, our baseline is what it looks like on Caucasian skin.
Are you saying that we don't know? So there's like, we just need to get more data and...
Yeah, so we need to start photographing more.
Okay.
And again, there's some work that's happening. I know Future Dreams Charity are doing a lot, and Breast Cancer Now are really behind that a lot as well. So it needs communities and women from our communities to come forward to have the confidence to be photographed. Because like we've already discussed, there's so many taboos around photographing the skin changes. So a couple of things that I've noticed through just my clinical work that I deal with women that I see from marginalised communities and the ethnic minority communities that I work with. I rarely say to black women, look for red skin, because it's not going to come up as red. It might come as discoloured or slightly darker skin. So they'll actually get a more purpley shade to their skin, because remember, the melanin in our skin, especially if you go darker with black or darker shades of brown, you might not come up that much. The other thing I say is that it's dimpling. You need to look at the dimpling as well. So I always show them the sort of the peel skin of an orange and say, this is what we're looking for. Nipple discharge, blood, or any white discharge is really important to look out for as well. Okay. And pain is a really sort of funny symptom, because the women instantly from ethnic minorities are looking for pain. We are so good at communicating pain. Sar dokhde, pair dokhde, sir to leke pera tak sara kuch dukta hai, which is translated as my head hurts, my feet hurts, I've got all over body pain. And that's because actually we're so good as a community to share physical symptoms. And so breast pain is actually the first thing that women come for from ethnic minority communities. But the data again shows that pain is not intrinsically linked with, say, breast cancer. So actually pain is not a good indicator of breast cancer. Very rarely would it be linked. If you've got pain and a lump, then it's important to sort of go and get that checked out with your doctor. But I see a lot of Pakistani ladies who will say number one symptom of breast cancer is pain. Still, even though if you look at all the checklists from breast cancer now, it's like we should be taking it out of there. But our communities, our South Asian or Black communities, still have a lot of second-hand information, and that's what they're sharing. And like we say, we vocalize pain a lot easier. So we need to break that myth out of our community a lot and say, do you know what, that's not the symptom that, it's really important that you know it and you follow it and you discuss it, but actually it's a symptom that's not actually significantly in proportion to breast cancer. So the other thing that we need to be aware of is an inverted nipple. Again, not many women would know what an inverted nipple is, but it's just an underfolding of your nipple as well. And then other places that you need to look for away from your breast. So we're looking for lumps. So we know about looking for your lumps in your breast. And I always say, imagine having a petit pois. This is how posh I am now. Petit pois. A pea. But a frozen pea. If you imagine that and you roll it between your fingers, we're sort of looking for something that represents that. Because some women will go, but I've got really lumpy breasts anyway, Dr. Nagat. And mine are exactly the same. I've breastfed 3 babies. So it's knowing what your normal is. But you're looking for that sort of hardness, and it's fixed possibly. It might not always be full. And it could be tiny. It could be literally, remember, because the earlier we pick it up, the more important. Don't wait for it to get bigger. No.
I was waiting for a lump, so it could be any size.
Any size, teeny tiny. And so you feel around the whole boob, underneath the nipple. We always forget to feel underneath the nipple. But I always say, go underneath the armpit. Again, women from my community never even know that sometimes they need to go under the armpit. And then up into the neck.
Oh, really?
Yeah, into the neck. Because we're looking for the lymph nodes, which are going to be travelling around the boob.
Okay.
So let's do a breast exam. Let's do
Cue the sound effect.
Okay. We're going to have a sound effect at some point with this.
A shave, kind of.
So this is great, because one of the things that I find always is we never look at our breasts. I mean, by the way, you have beautiful breasts.
Don't you?
I know. And I find that as Asian women, I don't know whether you found this, Shai, looking at your boobs is something so...
Don't look at your body.
You don't look at your body.
No.
But in order to do a good and effective breast check, I always encourage people to sort of look at themselves in the mirror, because that's when you can sometimes pick up skin changes. I mean, you can look here yourself as you might be doing it, but actually what you need to do is know what your normal is by looking in the mirror. And I always often get asked, how often should I do it? Do you know what? As often as you want. Like, I don't really mind, as long as you're doing it.
On my phone once a month, yeah.
The best time to do it, if you're thinking about what's the optimal time, is usually a week after your period. But then again, I know and I appreciate not everybody has regular
And
periods.
after menopause, you don't get that.
Exactly.
So.
And after menopause, you don't get that. So then I would say just put an alarm, like a date once a month, to say, this is my day, the first of the month. This is my reminder. I'm going to, after having a shower, it's a part of your routine, getting out in the bathroom, looking at the mirror, and then you sort of do a quick check of your breasts.
Yeah.
So I'm going to talk you through it, if that's okay, because I'm not going to touch you, because you are going to do this.
Okay.
So what you need to do is obviously look at your breasts, and we always say divide your breasts into 4 quarters. So a bit like that. And then I always find that putting your arm up also really helps, because then you can look for any obvious lumps and bumps underneath your armpit. So using the palps of your fingers, by the way, you can never do this wrong. Like, there's no really wrong way of doing it. But using the palps of your fingers, so if you get 4, like 3 or 4 of them, what you're doing is you're going around the breast tissue, and you're sort of feeling for a lump, and you're feeling for anything that's changed, and you're feeling for anything that you think, oh, that's new. So you're looking for new stuff as well, and then you're tracking the fingers.
How high do I go?
As high as up to your armpit, and then you're going in all of the quadrants of the armpit. And again, look, honestly, I don't care if you've not shaved your armpit and you want to come and see me, I don't mind. So that's really great. And then what you're doing is you're going up into the collarbone, That's it. You can pop. And then having a feel underneath the clavicle, because you're feeling for lumps and bumps, or your lymph nodes.
We're not taught to go this high.
I know. And that's it. And then when you come back down again, then you're looking at your nipple. If you can, you're looking for an inverted nipple. Skin changes. And then you might just want to roll your fingers around the nipple as well.
Okay.
To sort of feel if there's a lump underneath there.
Okay.
And again, you're looking for nipple discharge, an inverted nipple, skin changes.
Okay.
And then you do exactly the same on the other breast. So you, again, sort of having a feel in the four quarters.
I wonder if what part of the reason that we're not taught this is because it's seen as
Sexual.
overtly sexual to touch yourself.
100%.
Yeah, I think that's part of it. We're not taught to look at ourselves. We're not taught even to know what to look for. Because like I say, in different communities, the nuances are lost because there's new data that comes out, but we still hung on to the old data. And then we don't talk about the things that we need to look for very early on. Again, underneath your armpit, perfect.
And here as well, right?
Perfect. And it's as simple as that. It literally takes, I would say, for me when I do it, about 2 or 3 minutes. And sometimes you could just be, even if you don't have time, or just a little look, a feel around, and then getting to know what is normal for you. So now that you've had a really great feel of both of your breasts, it's really important to know that not all skin changes are going to be related to skin cancer. But knowing you're normal and examining yourself means that you can then differentiate whether something's changed or something is new. And I often get asked the question like, what does a lump actually feel like? Actually, it could be so insidious. It could be something so banal. It's just anything that's new for you. I sometimes say to my patients, just imagine a frozen pea and what that feels like. But that's not to say that's the case for everybody. It could be just a thickening of the tissue that's changed for you. It could just be the size of the breast as well. It could be something so subtle as that. We know that, sometimes we do get a bit of a differentiation, but you could have like a real different size breast to each other. And it could just be that actually just the shape of the nipple has changed. And the only way you'll know those really early changes is actually self-checking. It's better than any test that we've got available. Self-checking is the number one way to pick up breast changes and be aware of your breast health.
Just get to know your breasts.
Yeah.
Yeah.
Ultimately, any abnormality is worth a check, right?
Yeah, absolutely. And this is why it's so vital to make sure that even in between your mammogram appointments, that you are still self-checking and making sure that you're aware of your breast health. And it's not something that only sort of women or biological females need to do. A lot of my trans patients who are breast binding, I still say to them, please do check your tissue. As well as men need to check. We completely forget that men also have breast tissue.
But on
so
the
your
women,
brother needs to be aware of just
We've
checking.
never told him to check, yeah.
Yeah.
So when you get the letter, do you have to go every 3 years, or once you've done it once, or you just throw the letter away?
No, you have to go every 3 years. The invitation from the NHS breast screening programme starts around the age of just before your 53rd birthday.
Yeah.
And then every 3 years you go and you get invited. But it's really funny that you said that, because I'm just thinking my mother had her breast screening appointment. She kept it on the mantelpiece. And firstly, she said she's not going. And she just also was saying to me, okay, I'll go the once and then that's it.
Yeah, I've done it.
So how many screening
I've
appointments?
only had one.
And if you don't mind me asking, you're how old
60.
now?
60.
So what did you do when you
I
invited?
just threw the letters away. I just thought I've
right.
already been, so why do I need to do that again? I didn't realise that you have to, keep on top of it.
I actually didn't know, yeah. Otherwise I'd have pushed you.
Yeah, of course. But do you know what? You're not alone in this. And I think that firstly, that it's not embarrassing, or there's no shame attached to that, because there'll be so many women exactly like this. Because my mum was one. She just literally thought, I'll just do one appointment.
Yeah.
It's like a tick box exercise.
Yeah,
I've done it now. Yay!
Absolutely.
And I don't need to go again. But no, whenever the letter arrives, whenever you're called for your mammogram, please do attend the screening appointment.
I hope loads of people watching this remember to go ask their friends, their family members, their sisters, their brothers.
Yes.
Just go check, and add a notification to your diary. I have mine on the 1st of every month, just so I check on the 1st every month. But I do actually check while I'm in the shower.
Ask
quite
your
often.
mums not to throw the letters away.
Yeah, don't be throwing your letters away.
And maybe that's a really good point. Encourage
people
when
around
you know, because now obviously I,
Remind
being a
women,
doctor,
Yeah.
I encourage my mum, and I take my mum to her appointments actually. But that's a really good point, that if you know that your family member is coming into there, because they might just be in that mindset, well, it's just not for me, or I don't have any symptoms, so why should I go? But the whole point is that the screening program picks up stuff even before you get symptoms, so that we're able to pick up any changes, because then that way, the earlier we get the diagnosis, the better the prognosis is.
So get checking.
Get checking.
Yeah.
Oh my goodness, you guys, I've had the best day. I feel like at the start in the morning, me and my mum were kind of a little bit awkward around each other, just because we genuinely never had so many of those discussions before. Like, some of the stuff that she shared was legit my first time hearing her experience. The fact that she has stopped going for her mammograms because she thought she only had to go once is just crazy to me. I'm really glad that I know that, so I can make her go. Make sure that you catch up with all your loved ones and ensure that they're checking, that if they're within the age category of requiring mammograms, that they are going, because you do need to go more than once. Also, just wanted to show you this. On the way out from the Breast Cancer Now offices, I saw that they had this pamphlet which has diagrams of the female body with brown skin. How cool. I'm just not used to seeing that diversity. Very here for that accessibility. I do hope that today was useful. I hope that we all learned something. I for sure did. My mum definitely did. And yeah, it was a pleasure bringing you guys along for the ride, and I will see you guys for next week's vlog.